that caffeine will go straight through that blood-brain barrier and allow the drug to work a lot faster. Magnesium acts on neurotransmitters. It helps with blood flow. And I mean, it's something that a lot of people in pregnancy, if they're getting preeclampsia, they hang magnesium. I actually do that every day. I take 1 magnesium before I go to bed to prevent migraines.
Today, we are talking to Dr. Kimberly Johnson-Hatchett, who is a board-certified neurologist, all about treating migraines from over-the-counter treatments to prescription treatments. So let's get right into this. If someone's watching this and they suffer from migraines, what would be sort of, in your medical opinion, what would be the best sort of go-to over-the-counter treatments for them to start with?
Okay, so there's 2 different types of treatment for migraines. You have the abortive, or like when you have the headache and you want to get rid of the headache, and then you have the preventative. And both of those are available over the counter and also, of course, available as prescriptions. So I'm saying, I think if you have headaches in a predictable fashion, so like if you know the weather changes, so like bariatric pressure changes really do cause people to have increased risk of increased migraines. If you know that that's getting ready to happen, you could preemptively take things like ibuprofen, and NSAID, as long as your gut will allow you to take it, and Tylenol, a little caffeine. So like Excedrin migraine is a great over-the-counter medication if you're able to take caffeine, because it has caffeine, it has the NSAID, like the aspirin connected to it, and it has the Tylenol connected to it. So that caffeine will go straight through that blood-brain barrier and allow the drug to work a lot faster. So that is, to me, one of the best over-the-counter medications to actually abort the headache. In addition to that, some people get a little nauseated. They get a little irritated. So I sometimes add a little Benadryl to it. And then if they're really not feeling well, I add a little magnesium to it. So that's kind of like a concoction of medications that people take, and then I make them drink a lot of water to abort the headache from an over-the-counter standpoint. For a preventative side, over-the-counter medications and actually supplements like magnesium. Some people use magnesium oxide, but magnesium oxide can cause a little diarrhea. But it works. And the magnesium acts on neurotransmitters. It helps with blood flow. And I mean, it's something that a lot of people in pregnancy, if they're getting preeclampsia, they hang magnesium to help them with that. And we do the same thing. We hang magnesium if someone's coming into the hospital with status migrainosis, meaning that they've had a migraine for, bad migraine and they can't function. We hang magnesium to try and help prevent, to get the migraine to go away. So taking that on a daily basis as a preventative, I actually do that every day. I take 1 magnesium before I go to bed to prevent migraines. Riboflavin, it's a B vitamin. That is something that people can take on a daily basis to prevent migraines. So those 2 over-the-counter supplements are something that I usually start my patients off with if they're having headaches that are disrupting their life on a weekly basis. I start them on a preventative.
And how does that work in terms of the abortive medications versus the ones to actually treat? Are there some that fall into both categories when it comes to over-the-counter?
Well, like magnesium does, but really, I'd caution my patients against using NSAIDs every day from a headache standpoint, because you can have these transformative headaches because you're using the NSAIDs every single day. You can have this dull type of headache that is from taking too much NSAID. So that's something that I try to caution my patients against in using the NSAID or like ibuprofen as a preventative.
And so that kind of brings me to my next question, which is prescription medication. So is this typically when you would think about prescription medications for patients?
Yeah. And from a prescription standpoint, again, you have the 2 categories, right? And from a prescription standpoint, the go-to, the like gold standard treatment for abortives are these medications called triptans. Triptans act on serotonin in the brain, and there's lots of them. They've been around for, over 25 years, and there's all these different types of them. There's even triptans that have NSAIDs connected to them, like naproxen. There's one that has naproxen connected to it, and they are medications that you take at the onset of the headache, and then you take it. If your headache's still there 2 hours later, you take 1 more. But then you can only take like 4 in a week. So if you find yourself on these triptans and you're taking more than 4, that's when you want to go into preventative land. And the preventatives have all these different categories. So you can have preventatives that are blood pressure medications, like propranolol, not propofol. So from a preventative standpoint, for prescription medications, you can have all these different categories. So one could be like a blood pressure medicine, like propranolol, which is a beta blocker. You could have calcium channel blockers. You could use medicines that are seizure medicines, like topiramate or verapamil. All of them have a specific thing that they work on to help prevent migraines, but they also, of course, have side effects that you have to talk to the patient about and see if they're willing to deal with some of those side effects to prevent their headaches. Then you have injectables. So you have these once a month or once a week injectable medications, and a lot of people, Botox has been a game changer for them. And so that's something that I still practice in my practice is I do Botox on some patients every 12 weeks. They come in and get their Botox and they look great, but they also feel great too, because I'm doing it all in their forehead and in the back of their head. They're getting Botox injections for their migraines.
And Dr. Hatchett, where can people find you on social media if they want to learn more about you?
Sure. So I am on Instagram. I'm under Dr. Kim Neurodoc. You can also find me on my website, drkimberlyjhatchett.com. And I have a newsletter called The Bluff. It stands for the bottom line up front. And there's links on Instagram and on my website to sign up for the newsletter.